Hi, friend. You're in the right place. This is the Beauty in Burnt Toast. Life gets a little messy, faith gets real, and hope shows up when we least expect it. Guests pull up a chair to share their stories, the good, the hard, and the how did that even happen moments. So grab your coffee, maybe some actual burnt toast, and settle in. This is the Beauty in Burnt Toast. Welcome back to another episode of the Beauty in Burnt Toast. This is episode 2 of a 4-part series we are doing called Listening to Your Body, Deborah's Story of Breast Implant Illness. Today we are talking about learning to speak up and how to listen to your body. We touched on that a little bit last time, but we're going to go a little bit more in depth on that. This episode is all about that awkward, frustrating place where your body's waving a red flag and the doctors are kind of ignoring the signals. Have you ever been through that? I know she's been through that. We all go through that. Deborah gets real about the challenge of being a nurse who suddenly needs to be her own advocate, because sometimes the hardest person to convince is yourself or the doctors. But spoiler alert, God's whisper is louder than dismissal, and we're listening. So let's get into it. Last episode, we got to know a little bit about you, but as far as your journey in healthcare, let's talk about what started happening to your body.
Well, obviously, because of the fact that I am a real fighter type spirit when it comes to illness, and when you're in the medical field yourself, you tend to try to diagnose yourself and not feel like you need to go to the doctor because I'm already there. And so initially, I didn't really seek out that much trying to get someone to help me to figure out what was going on because I kind of had that know-it-all attitude of,
Yeah.
well, I think I know what's going on here,
Are you the kind of
you know?
person who ever pushes things aside too and is just like,
Oh,
oh, it's fine, nothing's
I
wrong?
could write the book on navigating dismissal.
Oh, God.
Oh, I feel that? No, I don't. Mm-mm.
Yes.
No, I do not feel that. No, there's no
Uh-huh.
pain. No, no, no. There's a problem here. No, there's not. No, I'm going to be fine. Because, part of that, I think, is my upbringing. And, I was raised in a Pentecostal holiness church. And my parents always taught me, don't deny your faith. Don't speak in a way that says, no, I'm not healed. No, I'm not okay. It's the power of positivity. And there is a lot of truth in some respects, to stating positivity and saying, I will survive. I will do well. I will defeat this. But whenever you're talking about just in general, looking at life and saying, okay, I've stubbed my toe, man, it's really bleeding and it's kind of, gushing, or like my husband when he's Mr. Tall walks through the building and all of a sudden he's peeled the scalp back because the low roof on the metal building, he forgets to duck and he's going, oh yeah, honey, just take a little super glue. And I'm going, no, we need stitches. We need stitches. So it's the denial aspect because we can handle it. We're
Yeah.
tough, or we have enough knowledge within ourselves, we think, to manage whatever it is that we encounter in life that's a healthcare issue. So, yes, I was notorious for that. But there weren't things that started out as being extremely obvious. There were things that were more subtle that begin to happen, and they begin to increase in severity over time. Certain things that started with a very slow onset, for example, with childbearing and carrying children. As women, we're carrying a pretty heavy load when you've got that little papoose in there baking for 9 months. And so, you make all the excuses of, oh, yeah, well, my feet are just, they are killing me. And they do. And, that's all because of the fact that we've come to accept that with pregnancy, there's going to be aches and pains,
Yeah.
and issues. But I developed problems when I was not pregnant that made me feel like, oh, wow, really? That pain that's going on? I can't walk. Now my hip is locked up. Now my feet are really aching. It hurt to even put my feet on the floor. And this is when I was in my 30s.
Mm-hmm.
Okay. So what do I do? Do I dismiss that? Is that okay? And Deborah looks back thinking on that here and says, at that time, my thought at that age and for what I had encountered in life at that point was that I just must have had a bad day yesterday. I overdid it. It'll be fine tomorrow. Again, dismissive, dismissive.
Mm-hmm.
Put it off. So I tended to do that in my healthcare. Other things became obvious and became apparent. And it wasn't until I started having additional things that began to kind of layer and pile upon each other
Mm-hmm.
that I began to be a little more introspective and to question myself and to say, wait a minute, let's see. Now, I know that if I'm this age, I usually order tests for patients to have this and that evaluated, but here's how old I am and here's what I'm experiencing. What's wrong with this picture?
So
Okay.
what were you experiencing at that
So,
point?
a lot of things that I began to experience were issues with hormones.
Mm-hmm.
Okay. And I went through polycystic ovarian syndrome, PCOS for short,
Mm-hmm.
having a lot of estrogen dominance in my body, which that's very typical,
Okay.
with having that.
What was that causing?
That was causing excessive growth of uterine fibroids.
Okay.
And with uterine fibroids, and also causing cysts that grow on the ovaries, those cysts can rupture and burst, become extremely
And
painful.
what does that feel like?
Oh boy, it feels a little bit like labor pain,
Mm.
just a little bit like labor
Okay.
pain. Yeah, to me. And when I experienced a lot of that, I didn't get into any issues with any endometriosis like some women do and that sort of thing. But because of having the fibroid uterus, uterine tumors that were going on that were benign, that caused a lot of pressure internally toward the front, anterior, and posterior portion of my body. And my surgeon said, my doctor said, see the surgeon says, we need to take your uterus out. You need a hysterectomy because you've already had a couple DNCs,
Mm-hmm.
dilatation and curettage, which is a procedure that they do to help women when they're having excessive menstrual bleeding.
Okay.
And that's very common with these conditions. And so I looked at him and I said, no, I don't, because my mother went through hysterectomy and I know what that entailed and I know what that did to her. And immediately, which she was 40 at the age, even older than I was when they were talking this stuff, that put mother immediately into menopause.
Mm-hmm.
Surgical menopause. Surgical menopause is bad news.
Yeah.
And for women who don't get help with that in the form of bioidentical hormone replacement therapy, it's going to cause multifaceted changes within your body.
How old was your mother when she went through all of that?
Mother was 40,
Okay.
and she also had a heart attack at the age of 40.
Wow.
So, a lot of these things with hormones, cardiac function,
Mm-hmm.
thyroid and cardiac are very closely intertwined. So, um, I looked at the doctor and I said, no, thank you. No hysterectomy for me. And all of a sudden, I vividly had this picture in my mind of a nursing home that I had worked in. And as an LPN at that time, I remembered giving an elderly lady a bed bath.
Oh gosh.
And I went out to grab the charge nurse because I was freaking out because what I had found in the bed. And it was very fleshy looking. And it was laying down between her legs, very close to her pubic area. And I thought, wow, this woman just gave birth to a tumor. It looked like a tumor to me in the pictures that I'd seen in the medical textbooks. And so I go out and get the charge nurse, and she looks and she goes, baby, that is her bladder. And I'm going, seriously?
What?
So she'd had a full hysterectomy. And unless a woman goes through a procedure called a Marshall Marchetti, which kind of tacks up the bladder because it's only suspended
Mm.
very mildly internally, to be held in place in your body, by cord that the name of it leaves me. But at any rate, that's all that you have, and it can end up, totally coming out. And there's a lot of women that talk about that. Well, let me just put my bladder back in.
Oh,
Yeah.
wow.
And I'm thinking, how do you function? Hold the press. I'm 30-ish. I have a husband. No. Actually, it was before I was 30. I said, no, no, I am not going to go through that. And he said, well, we can talk about hormones. And I thought, well, yeah, you're talking synthetic. Red flag. Um, we can also look at other options, but there is a procedure called an endometrial ablation. I said, okay, what's the endometrial ablation? So he explained that, and that's basically what I call the apple peeler whirligig, where they remove layers, and those layers hopefully end up getting all of the fibroid. And so I said, I think that's the plan. You can go in and do the ablation. That worked. That took care of things for me. And luckily for women, when you do enter natural menopause, your body's hormones are such that they kick in. And if you even have existing fibroids, they help with balance and management of that because of the way the hormones are actively working in the body at that given time in your life.
So, why do you think that he gave you the extreme choice before he gave you the not so extreme choice? Like, why was that his first call to do this major surgery?
Well, I think that because, no disrespect to him, but just being very point blank honest, it's because that decades ago, even in my mother's circumstance, that's a pretty big financial driver. Everybody was being hysterectomized in the late 70s and early 80s. You can go back and read the medical documentation on it, and that's what was happening.
Now you're getting into big pharma.
Yeah, and so, everybody, hey, let's take it out, pull it out. Oh, that problem, just take it out.
So it's not about the person.
No, it's not
It's about the
customized care. It's about money. And I'll also kind of go off on my tangent because we were having this conversation yesterday, my husband and I. We saw the same thing happen in the field of oncology. His mother had had breast cancer, had breast removed. 10 years later, fast forward, there's no breast tissue for cancer to come back into. And so the cancer comes back into her lung tissue. And so she goes through chemotherapy, chemotherapy, and chemotherapy. And we get to that point that, not only, of course, with chemotherapy killing cancer cells, they also kill the healthy cells, cells that line your heart and your kidneys and your internal organs. And we got to that point that she was actually only receiving salvage chemotherapy. And salvage chemotherapy won't be expressed to you as the patient, but it will be stated, we can give you more chemotherapy, Miss Smith, if you'd like. Sure, of course. We would be happy to do that. And yes, in her circumstance at that time, and this was 1999, right before she ended up passing, chemo at that point was about $3,000 to $4,000 back then per treatment.
Yeah.
Imagine what it is today.
Yeah.
So I point blank asked the doctor, I said, is this going to cure or change anything? He said, no, we're doing this because she wants it. And if they tell you they will provide it and you make a decision that you want it, you get it. So that's the only requirement is telling you what exists. You're put in the driver's seat for do you want it?
Yeah.
Do you not? And it's very lucrative.
So the education part's missing.
Exactly. It's not, hey, by the way, this is not really going to change your trajectory. Here's what we're looking at. Here are the outcomes. And considering the degree of cancer cells we see and what's going on, or the state of metastatic disease or the spread of this in your body, we can or can't heal you.
Yeah.
You aren't told all of that necessarily. So for me, I knew that I personally did not want to go through hysterectomy because I knew what it would mean to me as a female, as a married woman, as someone that didn't want to go immediately into surgical menopause. Already had enough obvious hormonal issues going on
Yeah.
and was even diagnosed with being hypothyroid, low thyroid. Say that 3 times. hypothyroid, and Hashimoto's.
So you had both of
And
those.
so, yes.
Okay.
And so Hashimoto's thyroiditis, and later ended up being diagnosed with multiple nodules on my thyroid, losing my voice, no longer singing in the church choir, and eventually getting to the point that I could not talk. So now you know why I talk so much.
So what were all of the symptoms with those things? You named several diagnoses, but what were the symptoms with all of those?
Well, some of the symptoms in other instances were changes in my weight, changes in my vision. I saw changes in my skin and in my hair. My skin became severely dry. My hair changed.
How did your hair change?
Well, typically in hypothyroidism, you can have some shedding and thinning of hair, but eventually for me, it went just beyond shedding and thinning to the point of falling out in handfuls and
Clumps.
having
Yeah.
missing gaps.
Ooh,
Totally gone.
yeah. Major red flags.
Major, just like, whoa,
Yeah.
you look like, have you had some chemo or something? So, really, really bad hair loss. The other things that happened were extreme visual changes and disturbances. And one of the ophthalmologists that was managing my care for over 7 years kept telling me, Deborah, I don't know what this mysterious situation is in your body. You're not diabetic. So it's not intraocular eye pressure, elevated eye pressure from glaucoma or anything like that. He said, but your vision is just rapidly deteriorating. I was forming nonstop styes and what are called chalazions and
What is it? What is this
hordeolums.
chalazion?
It's
Say that 5 times fast.
chalazion,
Yeah.
shalala. Blah. There you go.
So what is that?
So a sty or a hordeolum can become a chalazion, and it can become harder and more like a cyst that gets more
Okay.
permanent and can last longer. And I'll share with you one of these days photographs that I've saved of my journey, looking at how my eyes appeared. And if you have ever seen someone who, heaven forbid, someone that's an alcoholic or a drug induced person, or if you've been around somebody in a really poor, bad situation in life, my eyes were worse than the reddest eyes I've ever seen
Wow.
in my life. Just so bloodshot. It was sad, and nothing would touch it, nothing would fix it. And so this amazing doctor kept trying things. He put me on eye drops to, of course, keep the pressures down, because if the pressures get too high, you lose vision even more so. And the one thing they didn't tell me, which I should have known, was that I had sky blue eyes. Those sky blue eyes became brown because it does change your eye color. So
Wow.
I no longer have blue eyes.
That's insane.
Yes. So, and I can show you pictures of me with blue eyes.
Wow.
But that's okay. I still have my vision. But aside from the vision, I started also having profound brain fog. And when I had become a nurse practitioner, and with these symptoms over many years, changing, adding on, kind of layering, weight issues,
So
brain fog
brain
issues,
fog, what did that feel like? Describe the feeling of brain fog.
waking up feeling like you're in a cloud and you can never get your thought process straight. You can't stay on track with what you were doing. Walk into one room and go, wait, what did I even come in here for? And some of those little things are kind of normal, and especially if we get stressed, or if you're like me and a type A personality and you get kind of fast paced and you're doing things, I have to remind myself, to slow down
Yeah. So
so that I
assuming
can
this
keep
was on a
track.
much more elevated
So this
level.
was on a much more elevated level. And as a nurse practitioner, I found myself scrambling and saying, oh, wait a minute. I've looked at her. This is an ear infection, otitis media. I can't think of the drug that I prescribed.
Oh,
What?
gosh.
And, time is money in medicine.
Yeah.
So I can't be sitting there in the room, can't even remember, can't even write it. And it became so bad that I couldn't articulate. I couldn't verbalize. I couldn't say, Mrs. Jones, let me go over your labs and here's your report and here's what this means.
Yeah.
Let's discuss. Because you couldn't speak what you needed to say because the brain and the voice and the thyroid and the whole layering of everything that was happening affected my entire being. And I felt trapped. And I knew at that point, back in early 2019, that I was in deep doo. And I said, I cannot practice as a nurse practitioner like this. Something is wrong. Do I have Alzheimer's onset?
Yeah, that's scary.
What is happening? So very, very, very scary. So aside from that, fatigue became more pronounced, and I found that I had no energy, and it takes a lot of energy to think. It takes a lot of glucose uptake to the brain to make
Yeah.
the brain work when you're putting it into overdrive and you're trying to, communicate things effectively to people and treat and modify and all that. And that profound fatigue left me in a state of pretty bad depression. So, I knew that there were things that could be evaluated. I knew that there were other things that were mysterious, but still, it wasn't at that point that I said, this is really just going to make my whole body go downhill. It's going to get better, right? Okay, God, I'm praying,
Yeah.
this is going to change. And so, being that person of faith, I held on to God and I held on to that faith that He'd go ahead and take things as they were and make them better. And not to say that God can't and God wouldn't, but He gives us medical knowledge, He gives us medical providers,
Yes.
He gives us people to come into our paths, to be aligned with us, to empower us again with that knowledge.
Well, and he gives us the intelligence to know when we need to ask for help as well.
Amen.
Yes.
Yelp for help.
So, what was the final straw?
Probably the final straw for me was when I began to develop breathing issues
Oh,
that came on very suddenly.
wow.
And they exacerbated, meaning that they got worse really quick.
Let's
really
have a time
fast.
frame real quick. Okay. So, when did these symptoms kick in and when did the breathing issues start happening?
I had symptoms that started within 2 years initially of the time that I had implants placed into my body.
Okay.
In
How old
in
were
my
you
20s.
in your 20s? Okay.
And now looking back retrospectively on all of that and looking at timeline, the puzzle pieces all made sense ultimately.
So, symptoms within 2 years.
Symptoms within a
So,
couple
how
of
long
years.
did we deal with symptoms before we were like, I'm done?
Oh boy. I was 58.
A very long time. Wow.
I was 58
So, you
when
struggled
this
for
hit.
quite a while.
Absolutely.
Yeah.
And not only physically, but I can't even begin to tell you the emotional and the mental anguish and impact really changed a lot in relationships. And I thought, wow, this is so not me. But it's so hard when you're in that moment and you're in that pain and you're going through something like that to step back and look and realize that disease process is creating a whole load of things to happen to your body
Yeah.
that are outside of your control. And I'd always been that person that said, I can handle it, I can control it, I can endure it. And God began showing to me, no, you can't. No, you can't. You need the higher power.
Yeah.
When are you going to listen? And so when I got to the point of having breathing issues, because of the fact that early in my career that was very diverse that I told you about, I worked also in the field of cardiology, which I loved. And I thought, Heavenly Father, am I developing congestive heart failure because I can't breathe? And that was my first initial thought, because I could not lie flat in the bed and breathe. I could not hold a conversation on the phone and breathe. I was trying to talk to someone and panting the whole time like I'm running a race, so it was very disparaging. Didn't know what was up. I had a recliner and I had to use that recliner and was sleeping an average of 2 hours
Oh,
per
man.
night.
You don't want to be around me if I'm sleeping for
And
two
that
hours
was
a
it.
night.
And that builds upon itself and turns
Yes.
you into a real bear
Yeah.
because you go without sleep and sleep deprivation in itself.
She-Hulk.
Oh, yeah. So it was intense and it was terrible. And one night with trying to get sleep and during a wake up phase, something kept inspiring me. Look at your cell phone, check your email, check your email. And I thought, oh, Heavenly Father, if that's your voice speaking to me, I'm so tired. Why do I want to look at email? I'm not working. Why do I need email? Hello. And it just kept persisting. And I thought, okay. So I whip out the phone and I look. What the email actually said was, Dear healthcare provider, starting today, we're alerting you to let you know you might want to tune in. There will be a 2-day hearing with the Food and Drug Administration, and the FDA is actively conducting hearings regarding the safety and efficacy of breast implants. Those hearings begin being televised today at 8 a.m. And here I am just getting word of that within hours of the time before it airs on television. So I'm going, okay, it's what time? I'm staying awake for this. Absolutely.
So you dove in and listened to the whole thing.
I listened to the whole thing. I even used my cell phone to record some parts from it. I even later on YouTube found some of those testimonies that were given that I still have saved in my archives that I use and refer to and help other people with pulling those out.
You very much
But
related to some of those testimonies.
oh, wow. I sat there and bawled and cried like a baby because, here I am asking God, please, Heavenly Father, help me to understand what's going on with my body. It had never in my wildest dreams dawned on me that my problems could even remotely be related to my breast implants. And I was learning then in 2019 at that time that these women were talking about how they had explanted. They were talking about the symptoms they had. They're standing and they're crying and they're begging and they're pleading. Some of them even had cancer that was hidden between the implant and the capsule, aka scar tissue. There were specialists from all different countries. There was a Canadian doctor who was there. There were research doctors there. There was history there regarding the FDA and the back history regarding everything that we know that happened from the Dow Corning days when women were actually directly injected silicone, for example, into their chests. And, I had a little bit of a red flag in the back of my mind, quite honestly, whenever I had gone to get a removal and replacement 9 years after getting that first set of breast implants when I was a very young woman to take care of asymmetry that I had going on in my chest. I had mistakenly breastfed my children too much on one side because I'm right hand dominant. So I ended up with one breast significantly different in size than the other. And I had gone in, as we say in medicine, I had presented to a plastic surgeon in Birmingham, Alabama, asking to get one implant put in. And he said, no, we don't do that because it changes the shape of your chest and your breast. And so that's where things started. But when I had that removal and replacement surgery done, that happened 9 years after getting the implants. And I was never, ever told at all that breast implants were not lifelong devices. I was told, you'll have these, it will be great, you'll have them forever,
Yeah.
you're going to look fantastic. Well, in whoever's eyes that fantastic is, I'd really love to know because I'll tell you more later about what I found out at the point when I did get them removed. But with sticking with where we are in the story at this point, pretty much basically watching the FDA hearings, hearing from the specialist, and then seeing a renowned microvascular plastic surgeon who was affiliated with Cleveland Clinic getting up and telling her story that she had only exclusively performed explant, which is removal of breast implants, for the last 35 years.
Wow.
Because she had already realized in her career how damaging they are, what they do to the body, how they destroy the autoimmune system, and how they damage so much that it's sometimes just not even repairable. And that's the sad part of it all. And to me, that red flag that I'd had initially at that point when I had the removal and replacement was hearing in my head that same surgeon saying, well, you know, they're going to be putting silicone back on the market again. They'll be releasing it as safe. Now, this was years ago. This was decades ago I'm talking about,
Yeah.
because FDA was notorious for put it on the market, take it off the market. It's safe. No, it's not safe. And so that in my head started going ding, 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 ding. Don't you remember that, Deborah? There was something about it. For me, I had saline breast implants. They were intact, but the trajectory for women that I've learned through specializing in this arena over the years is that saline and silicone are two different beasts, but silicone is what covers all implants. Even if you have saline, they do have a silicone cover
So you
or
have it
shell.
anyways. Yeah.
Right. And they all have a capsule, which is scar tissue that grows around them in response to the body saying, what did you put in here? Okay. We've got to shield the rest of the body from this. This is foreign. Wow, this is big.
Yeah.
It's next to your heart. It's next to your lungs. What are you thinking, And so your body just keeps building that scar tissue and that scar tissue. And I learned from the explant surgeon that the degree of the thickness of the scar tissue around a breast implant, when it's removed properly from the body, reveals the degree of the inflammatory process that's been fighting and that person has been battling internally within them.
Let's kind of back up. So, in the midst of all of this, in the midst of your pain, I want to point out like this is kind of the second time that you have alluded to that still small voice, that nudging. And I really want to reiterate that because you were in bed, correct? And you just heard that. Check your email.
Yeah,
Check your email.
I was sitting in a recliner in
Yeah.
the den because bed was no longer a part of
yeah.
the equation for
Well,
me.
that was your bed.
That was my
But
bed.
he was saying to you, I see you. Like, I see you in your pain. Like, this is your answer. Like, I am leading you through this entire process. So that's what I want you to know. Like, we go through so many things, but he is with us in that entire process. If you pay attention, he is pointing things out. He is leaving those breadcrumbs. So
He
pay
does.
attention to your body. But we will get more in depth on this on the next episode. Please follow along so you can hear her explant journey. If you take anything from this episode, let it be speaking up is not bossy, it's brave. Next time, Deborah shares when the puzzle pieces started clicking, when the illness finally had a name and a face. It's not all sunshine, but there's plenty of grace there. See you next time.